Today, our lesson is about Bishop's score when a mother is expecting. Before starting an induction of labor, healthcare providers must first determine whether the cervix is ready for the process of childbirth. The cervix acts like a gate that must open to allow the baby to pass through during delivery. To evaluate whether this gate is ready, providers use a clinical tool called the Bishop score. The Bishop score is a 13-point scoring system used to predict whether induction of labor is likely to result in a successful vaginal birth. It can be compared to a pre-flight checklist before an airplane takes off. Just as pilots confirm that everything is ready before departure, healthcare providers assess the cervix to ensure conditions are favorable before initiating labor induction. This helps improve outcomes for both the mother and the baby. During a cervical examination, the healthcare provider evaluates 5 important characteristics that indicate how prepared the cervix is for labor. The first characteristic is dilation, which refers to how open the cervix is measured in centimeters from 0 to 10. A cervix that is more open receives a higher score because it indicates readiness for delivery. The second characteristic is effacement, which refers to how thin or shortened the cervix has become. As labor approaches, the cervix gradually becomes thinner, allowing it to stretch more easily during birth. The third characteristic is station, which describes how low the baby's head has descended into the mother's pelvis. The lower the baby's head is positioned, the higher the likelihood that labor will progress successfully. These 3 characteristics, dilation, effacement, and station, are each assigned a score ranging from 0 to 3 points depending on how favorable the findings are. The provider also evaluates 2 additional cervical characteristics, which are consistency and position. Consistency refers to how firm or soft the cervix feels during examination. A soft cervix indicates that the body is preparing for labor and is more favorable for delivery, while a firm cervix suggests that labor is not yet imminent. Position refers to the location of the cervix in relation to the vaginal canal. A cervix that has moved forward toward the front of the vagina, known as an anterior position, is more favorable for labor than a cervix that remains tilted toward the back, known as a posterior position. Consistency and position can each earn up to 2 points. After evaluating all 5 characteristics, the points are added together to calculate the total Bishop score. A total score of 8 or higher indicates that the cervix is considered ripe or favorable, meaning the body is ready for labor induction, and there is a higher probability that the induction will lead to a successful vaginal delivery. However, if the total score is 5 or less, the cervix is considered unfavorable, meaning that the body is not yet ready for labor. In such cases, healthcare providers do not immediately begin medication such as oxytocin, commonly known as Pitocin, which stimulates uterine contractions. Instead, cervical ripening agents such as prostaglandins may be administered first to soften the cervical tissue, increase dilation, and improve the Bishop score before induction begins. Understanding the Bishop score allows nurses and doctors to better plan care, manage expectations, and reduce the risk of a failed induction. Failed inductions can increase the likelihood of complications such as prolonged labor, maternal exhaustion, fetal distress, and unplanned cesarean birth. By ensuring that the cervix is adequately prepared before induction, healthcare providers improve the chances of a safer and smoother vaginal delivery. If a patient is dilated 3 to 4 cm, 2 points, 60-70% effaced, 2 points, at one station, 1 point, with a soft cervix, 2 points, in an anterior position, 2 points, what is their total Bishop score? And is their cervix considered favorable for induction? Drop your math and your answer in the comments section.